Hello, everyone. Thank you for joining our call today. My name is Malia Richmond-Crum, and I'd like to welcome you to a CDC stakeholder call within a series titled Helping Communities Plan for, Respond to, and Recover from the COVID-19 Pandemic. Today's call is focused on workplaces and mass transit. A few housekeeping items before we begin. Please know that this call will be recorded and later posted on the CDC COVID-19 website. This call is not intended for the media. If you are the media and have questions, you can direct those inquiries to media@cdc.gov. On the call today, we will hear a situational update from Dr. Margaret Kitt, followed by information on community mitigation strategies for workplaces and mass transit from subject matter experts within CDC's COVID-19 response. We will then have a Q&A session based on questions submitted in advance via email. So with that, I'll introduce our speakers. Today, I'm joined by Dr. Margaret Kitt, Dr. Monica Adams, Dr. John Omura, and Dr. Jennifer Murphy. Dr. Margaret Kitt is currently deployed to CDC's COVID-19 emergency response as a Deputy Incident Manager for Community and Health Systems. Outside of the response, Dr. Kitt serves as the Deputy Director of the National Institute for Occupational Safety and Health, or NIOSH. Dr. Kitt is an occupational medical physician and has worked for NIOSH since 2002. She retired from the United States Public Health Service in 2018 at the rank of Rear Admiral. Dr. Monica Adams is an epidemiologist on the Community Intervention and At-Risk Task Force within CDC's COVID-19 emergency response. Her research experience outside of the response focuses on prevention of infectious diseases such as HIV among people who inject drugs. Dr. John Omura is currently the Deputy Team Lead of the Community Guidance Team within CDC's response. And outside of the response, Dr. Omura serves as a medical officer with our Division of Nutrition, Physical Activity, and Obesity. Dr. Omura is trained in both family medicine and preventive medicine. And finally, we're joined today by Dr. Jennifer Murphy. We know that people have a lot of questions about cleaning and disinfecting. Dr. Murphy is a team lead for the water, sanitation, and hygiene team within the response. And outside of the response, she serves as CDC's environmental microbiology and engineering laboratory team lead in the waterborne disease prevention branch. And with that, I'll turn it over to Dr. Kitt to share a situational update on the response.
Thank you for that introduction, Malia. I'm pleased to have the opportunity to speak with all of you today on considerations for workplaces and mass transit. Across CDC, we are working closely with the White House Corona Task Force and other federal partners to slow the spread of COVID-19 and ensure communities remain safe, healthy, and resilient. There are currently 57 jurisdictions reporting COVID-19 cases to CDC. This includes all 50 states, New York City, DC, the Commonwealth of the Northern Mariana Islands, Guam, Puerto Rico, U.S. Virgin Islands, and the Navajo Nation. As of today, there are 1,516,552 confirmed and probable cases and 91,591 deaths in the United States reported to CDC. CDC is actively engaged in the whole of government plan to get and keep America open safely and efficiently by providing critical information about COVID-19. CDC is also providing direct and tailored technical assistance and support to state, territorial, local, and tribal health departments as they consider approaches to slow the spread of, mitigate, and contain COVID-19. Mitigation and containment of COVID-19 is essential to get and keep America open, and CDC is committed to leveraging our expertise and partnering with others on the front lines as they make decisions about when and how to adjust community mitigation efforts. CDC is continuing to provide guidance and implementation tools to assist state and local partners and other stakeholders in making decisions about adjusting mitigation strategies to protect public health. I'm pleased to note that CDC has published a variety of resources to support reopening efforts. These include decision tools focusing on a variety of venues, including one that focuses on mass transit and one that focuses on work sites. Updates also include additions to the document that's entitled CDC Activities and Initiatives Supporting the COVID-19 Response and the President's Plan for Opening America Up Again, by including 2 new appendices to assist public health and government officials in making decisions on when and how to reopen communities and specific settings. Earlier this week, CDC released health considerations documents to help businesses and community organizations operate as safely as possible during the COVID-19 pandemic. These documents support summer camps, schools, youth sports organizations, institutes of higher education, and restaurants and bars. CDC previously posted health considerations for operating aquatic settings. The considerations documents complement other CDC resources, including interim guidance documents that are posted online and the decision tools that I mentioned earlier. These help inform decisions about resuming and gradually scaling up operations. Together, these critical resources are intended to help communities plan for, respond to, and recover from COVID-19. CDC will continue to update these resources to help state and local leaders as they implement, adapt, and adjust COVID-19 mitigation strategies in their communities. I want to emphasize that none of these resources supersede state, local, territorial, and tribal public health recommendations. All of these resources emphasize the importance of working with appropriate health officials and adjusting to meet unique needs and circumstances of the local situation. Decisions and strategies about how to operate are implemented at the state, local, territorial, and tribal levels because every locale is different and individual jurisdictions have the authority and local awareness needed to protect their communities. As you know, there's currently no vaccine to prevent COVID-19. The best way to prevent infection is to avoid being exposed to the virus. Here are some of the steps that CDC recommends to help prevent the spread of COVID-19. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing or sneezing, using the restroom, and before eating or preparing food. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if your hands are visibly dirty. Avoid touching your eyes, nose, and mouth. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue and then throw the tissue to the trash, or use the inside of your elbow to cover your cough or sneeze if a tissue is not available. Wear a cloth face covering in public settings, especially where social distancing measures are difficult to maintain, like a grocery store or a pharmacy. But please note, you should never place a cloth face covering on children under age 2, or people who are having trouble breathing, or anyone who cannot remove the covering without assistance. Clean frequently touched objects and surfaces using soap and water, and then disinfect using a product from EPA's List N, Disinfectants for Use Against SARS-CoV-2. Practice social distancing. This means maintaining at least 6 feet of physical distance between you and other people in community settings and staying home as much as possible. And with that, I'd like to turn it over to Dr. Monica Adams from our Community Guidance Team within CDC's COVID-19 Community Intervention and At-Risk Task Force to discuss workplaces.
Thank you, Dr. Kitt, and thank you for this opportunity to speak to you all about this really important topic and the resources that we at CDC have here to support you. So as we begin, I want to highlight 2 important points that Dr. Kitt touched on, which is staying informed and connected to your local health officials, as well as protecting employees at higher risk. As workplaces consider scaling up activities and operating practices, it's going to be particularly important to keep in mind that some employees will be at higher risk for severe illness. So as a worker's age increases, their risk of severe illness from COVID-19 also increases. Additionally, those with underlying medical conditions may be at increased risk. So these conditions include chronic lung disease, moderate to severe asthma, severe heart conditions, compromised immune systems, also severe obesity, diabetes, liver disease, and chronic kidney disease that requires dialysis. So workers at higher risk for severe illness should be encouraged to self-identify. Employers should avoid making unnecessary medical inquiries. An employer should take particular care to reduce workers' risk of acquiring COVID-19 while at the same time making sure to be compliant with relevant Americans with Disabilities Act and Age Discrimination and Employment Act regulations. So also throughout all the steps of scaling up operations, employers should establish and maintain communication with local health officials and other state and local health authorities. These officials can really help you assess the current level of mitigation that's needed based on the COVID-19 community transmission and the capacities of local public health and the healthcare systems in that area. So our recommendations are really divided into 3 areas: preventing and reducing transmission among employees, maintaining healthy business operations, and maintaining a healthy work environment. These strategies apply to workplaces generally, and specific industries might require more stringent safety precautions, and so you can find additional guidance for specific industries on our web pages. Okay, first let's talk about how to prevent and reduce transmission among employees. Businesses can consider conducting daily health checks of staff safely and respectfully, and of course in accordance with any applicable privacy laws and regulations. These health checks may include temperature screening or symptom checking, or both. Businesses can also encourage additional behaviors that prevent and reduce transmission, such as actively encouraging employees to stay home when they or someone in their household is exhibiting symptoms of COVID-19. Of course, you can promote social distancing and encouraging individual behaviors that prevent spread, like required hand washing and following good respiratory hygiene, covering coughs and sneezes with a tissue or the inside of an elbow, and using cloth face coverings as feasible, especially when physical distancing is difficult. As Dr. Kitt mentioned, cloth face coverings are not recommended for anyone who has trouble breathing or otherwise unable to remove the covering without assistance. Employers can also put systems in place for having staff self-report if they have any symptoms of COVID-19, a positive test for COVID-19, or were exposed to someone with COVID-19 within the last 14 days. Businesses also prepare for if someone does get sick. So this can include designating a staff person to be responsible for responding to COVID-19 concerns and making sure that all employees really understand how to get in touch with that person. Having a procedure in place for safely isolating and transporting a person who's sick, notifying health officials and close contacts if there are cases inside a facility or business, and advising sick individuals of the home isolation criteria. Next, I want to talk about maintaining a healthy business operations. To maintain healthy business operations, you may consider implementing flexible sick leave policies and practices. You may also want to offer employees at higher risk for severe illness options, such as telework or modified job responsibilities that limit exposure or risk. You can modify work layouts to ensure that all individuals remain at least 6 feet apart as you can, and closing communal space like break rooms, and discouraging people from sharing items that are not easily cleaned, sanitized, or disinfected. You may also rotate or stagger shifts to limit the number of employees in the workplace at the same time, and decide to conduct events, gatherings, or meetings virtually if possible, and promote social distancing in the event that events are held. Businesses also may consider installing physical barriers such as sneeze guards and partitions, and changing the workspace layouts to ensure all individuals remain at least 6 feet apart. I also want to touch on maintaining a healthy work environment. So improving the engineering controls using the building ventilation system is one thing that an employer could consider. This may include increasing ventilation rates and ensuring ventilation systems operate properly, and increasing outdoor air ventilation, of course using caution in highly polluted areas. Employers can also ensure the safety of the building water system and devices after a prolonged shutdown like we've had. Businesses may give employees customers, and visitors what they need to clean their hands and cover their coughs and sneezing, ensuring access to adequate supplies like soap and water, hand sanitizer with at least 60% alcohol, paper towels, tissues, and foot pedal trash cans. It may also be helpful to place posters that encourage hand hygiene to help stop the spread at the entrance of your workplace or in other areas where they're likely to be seen. Businesses will also want to consider cleaning frequently touched surfaces at least daily and shared objects between use, and also ensuring safe and correct use and storage of disinfectants. Being aware of local or state regulatory agency policy on gathering requirements and the recommendations can help you determine whether events can be held. So the decision tool for work sites that is available on our website incorporates all of these principles in a tool and guides employers through suggested steps of decision making. For instance, the decision tool suggests 2 important initial considerations. 1, will reopening be consistent with applicable state and local orders? 2, is your business ready to protect employees at higher risk for severe illness? If the answer is no to either of these questions, we suggest that you are not ready to open. But if the answer is yes, we suggest moving to the next step. This step addresses checks for ensuring that recommended health and safety actions are in place. After reviewing the actions, employers are then asked to consider, can they have ongoing monitoring in place? If businesses are successful in implementing all the steps of the decision tool, then we suggest reopening and monitoring can occur. This overview was a brief summary, just highlighting the information and materials that are available on our web pages. Now I'd like to turn it over to Dr. John Omura to talk about considerations for mass transit.
Thank you, Dr. Adams, and thank you for the opportunity to speak with you all today about considerations for mass transit administrators. Mass transit is critical for many Americans to commute to and from work and to access essential goods and services. As Dr. Kitt noted, interim guidance for mass transit administrators can be found in the President's Plan for Opening America Up Again. This guidance provides considerations for mass transit administrators to maintain healthy business operations and a safe and healthy work environment for employees, while reducing the risk of COVID-19 spread for both employees and passengers. We also have a decision tool for mass transit administrators. And finally, our COVID-19 web pages include guidance for many types of mass transit workers, including bus transit operators, rail transit operators, transit maintenance workers, and transit station workers. And I urge you all to take a look at these resources. So first, I'd like to walk you through the decision tool document as it provides an overview of CDC recommendations for transit in 3 steps. We suggest 2 important considerations for the first step in decision making. 1, will increasing service be consistent with applicable state and local orders? And 2, are you ready to protect employees at higher risk for severe illness? If the answer is no, we suggest that transit administrators are not ready to increase service. But if the answer is yes, we suggest moving to the next step. The second step in the decision tree is making sure recommended health and safety actions are in place. This step includes several checks for mass transit administrators, including promoting healthy hygiene practices, encouraging employees to wear a cloth face covering as feasible, vehicle cleaning and disinfection, and encouraging social distancing in transport vehicles and buses by increasing spacing of passengers and employees, closing every other row of seats, and using rear entry and exits of buses if possible. It also includes limiting routes to and from high transmission areas and training all employees on health and safety protocols. If all of the points in this step are considered, we suggest then moving on to the third step, which is making sure that ongoing monitoring is in place. This means developing and implementing procedures to check employees for signs and symptoms daily upon arrival, encouraging anyone who is sick to stay home, and planning for if an employee gets sick. Additionally, it means monitoring what's going on in your workplace with wellness checks and other reports of sickness, and having regular communication in place with local authorities, employees, and the public. Implementing flexible leave policies as feasible, and consulting with the local health authorities if there are cases in the facility or area. If the considerations in these 3 steps are met, we suggest that service can be increased with monitoring. Next, I'd like to walk you through the interim guidance that was mentioned. CDC released this interim guidance laid out in a series of 3 steps to inform a gradual scale-up of activities. The scope and nature of community mitigation suggested decreases from steps 1 to 3. All decisions about following these recommendations should be made in collaboration with local health officials and other state and local authorities. The strategies included within the interim guidance are grouped into several categories. So for example, resuming full service, safety actions, promoting social distancing, monitoring and preparing, and adjusting service. To resume full service, mass transit administrators may consider adjusting routes between areas experiencing different levels of transmission to the extent possible, providing employees telework and other options for work as feasible, establishing and maintaining communication with state and local health officials, considering assigning workers at higher risk of severe illness to duties that minimize their contact with passengers and other employees, and conducting worksite hazard assessments to identify COVID-19 prevention strategies. For safety actions, mass transit administrators may consider promoting healthy hygiene practices, and some actions here include enforcing everyday prevention actions such as hand washing, covering coughs and sneezes, and using a cloth face covering by employees when they're around others as safety permits. Also providing employees with appropriate personal protective equipment as necessary and as available. Communicating with the public about the importance of hygiene, covering coughs and sneezes, and using cloth face coverings while using mass transportation. And ensuring adequate supplies to support healthy hygiene behaviors for transit operators, employees, and passengers in stations. Safety actions also include intensifying cleaning, disinfection, and ventilation. So for example, cleaning and disinfecting frequently touched surfaces at least daily or between use as feasible, cleaning and disinfecting the operator area between operator shifts, using touchless payment and no-touch trash cans and doors as much as possible when available, ensuring safe and correct application of disinfectants, and ensuring that ventilation systems operate properly and increase circulation of outdoor air as much as possible, such as by opening windows and doors. To promote social distancing, mass transit administrators may consider instituting measures to physically separate or create distance of at least 6 feet between all occupants to the extent possible. So for example, this may include asking bus passengers to enter and exit the bus through rear doors while allowing exceptions for persons with disabilities. Also closing every other row of seats, reducing maximum occupancy of buses and individual subway and train cars, and increasing service on crowded routes as appropriate. They can also consider providing physical guides to ensure that customers remain at least 6 feet apart while on vehicles and at transit stations and stops. So for example, this can be things like floor decals, colored tape, or signs to indicate where to sit or stand or where not to sit or stand. They can consider installing physical barriers such as sneeze guards and partitions at staffed kiosks and on transit vehicles to the extent that's practical. And closing communal spaces or staggering their use and cleaning and disinfecting in between uses. For monitoring and preparing, mass transit administrators may consider conducting daily health checks of employees and encouraging sick staff to stay home. Administrators can also plan for when an employee becomes sick, including isolating and transporting those who are sick, notifying health officials and close contacts if there are cases in the facility, and advising sick individuals of home isolation criteria. To maintain healthy operations, administrators can consider designating a staff person to be responsible for responding to COVID-19 concerns, implementing flexible sick leave policies and practices, creating and testing communication systems for employees and customers for self-reporting of symptoms and notification of exposures and closures, and supporting coping and resilience among employees. And then finally, to adjust service, mass transit administrators may consider coordinating with state and local health department officials about transmission in the area, being prepared to consider adjusting services as appropriate if the community mitigation level increases in the local area, and communicating with staff and the public about decision making. So that's a quick summary of these documents, but I'd like to point out again that much more information for mass transit administrators and workers is available on our web pages. Now I'll turn it back over to Malia. Thank you.
Thank you. Thank you, Dr. Kitt, Omura, and DrAdams. You've shared a lot of information today on this call. and quickly providing summaries of some key resources that are now available on CDC's website. We'd like to just talk through a few questions that came in advance of our call today to help people really understand how they can keep their employees safe as well as their customers as we move into the reopening of America. So the first question really gets to that, and this question is for Dr. Adams. Somebody emailed us and wanted to know, how can I protect employees who may be at higher risk for severe illness?
Thanks for that question, Malia. Before I get started, I do want to mention that many of the principles for businesses apply to mass transit. I'm sure that Dr. Omura and others will get into more specific strategies, though, as they apply to mass transit. So, as I mentioned, protecting employees at higher risk for severe illness is an important initial decision for your business. So, really having conversations with employees if they express concerns is going to be important. Some people may be at higher risk because of age, and others might have some underlying medical conditions. But using strategies that help prevent the spread of COVID-19 in the workplace, you're going to protect all employees, including those at higher risk. So again, these are many of the strategies we discussed before, like implementing telework or staggering shifts and other social distancing practices, actively encouraging employees to stay home when they're sick, promoting hand washing, and providing supplies and appropriate personal protective equipment for cleaning and disinfecting workspaces. So in workplaces where it's not possible to eliminate face-to-face contact, like in retail, consider assigning higher risk employees tasks that allow them to maintain 6-foot distance from others, if at all possible or feasible. So maybe doing some stocking, things like that, working on the telephones. Employers should not require that employees provide a note from their healthcare provider when they're sick, and instead allow them to inform their supervisors or their employee health services when they have conditions that put them at higher risk for diseases. And that has a lot to do with the capacity that we have in our healthcare system to quickly respond and provide employers with that information, as, of course, confidentiality permits.
Thank you, Dr. Adams. That was very helpful. And relatedly, Dr. Kitt, maybe you can help us with the next question, which is, what should I do if an employee has a respiratory illness?
Well, employees who appear that they may be ill or have symptoms such as fever, cough, or shortness of breath when they arrive to work, or even if they become sick during the day, should immediately be separated from other employees, customers, and visitors, and certainly sent home for the day and for the period of time in which they're ill. CDC does have a symptom self-checker chat bot, which is called Clara. We call it the Clara bot, that is available on our website, where employers and employees may log in and find some helpful information, because it has a series of questions and recommendations as to what level of care might need to be sought, if any, and the user can then go ahead and seek the medical care that they may need. It's not really intended to provide diagnosis or treatment, but it does help you walk through an algorithm that could be helpful in trying to determine what the next steps are. So hopefully that helps folks sort of determine what they would do in case of an ill employee showing up to work.
Thank you. And you know, unfortunately, we know that many thousands of people are getting COVID in the U.S. You know, but what should an employee who has confirmed COVID-19, when should they return to work after they've been ill?
So sick employees should follow the steps to prevent the spread of COVID-19 if you are sick, which is available on the CDC website. Employees shouldn't return to work until they meet criteria that are outlined there to discontinue home isolation. And they should consult with a healthcare provider and state or local health department. Employers should not require sick employees to provide a negative COVID-19 test result or a healthcare provider's note in order to return to work. Employees with COVID-19 who have stayed home can stop home isolation and return to work when they've met some of the following sets of criteria. So we have two options that are available, and again, these are listed on the website, and it's really based on option 1 and option 2, which are differentiated by whether an individual has had a test or not. So let me walk you through that. Option 1 is if in consultation with the healthcare provider and the local public health authorities who really know what locally available testing resources there are, it's determined that an employee will not have a test to determine if they are contagious. The employee can leave home and return to work after 3 conditions have been met. 1, the employee has had no fever for at least 72 hours, and that's 3 full days of no fever without any medication used to reduce fevers. And also respiratory symptoms have improved. For example, cough or shortness of breath have improved. And third, at least 10 days have passed since their symptoms first appeared. Now, option 2 is based on whether the employee has consulted with a health care provider and the local public health authorities once again, and it's determined that the employee will be able to have a test to determine if the employee is contagious. So in that case, the employee can leave home after these 3 conditions have been met. 1, the employee no longer has a fever, again, without the use of medication that reduces fevers. And 2, respiratory symptoms have improved. And 3, they've received 2 negative tests in a row, at least 24 hours apart. And their doctor should follow CDC guidelines on those testings. So I realize those are a little caveated between the option 1 and option 2. So I would refer you to the CDC guidance about this to really look through it and study it in more detail, so you have the exact wording down there on the web page.
Thank you. Thank you. I think that's very helpful. We're getting a number of questions in the question and answer box that get to cleaning and disinfection. So I was hoping maybe that Dr. Murphy, you could talk a little bit more about that. Could you provide some more information about cleaning and disinfection guidance after a COVID-19 case has been confirmed?
Yeah, sure. That's a good question. So CDC has guidance for cleaning and disinfecting community facilities. So this includes schools, daycare centers, and businesses after persons who are suspected or confirmed to have COVID-19 have been in their facility. So first, we recommend closing off areas used by the person who is sick. So companies don't necessarily need to close operations if they can just close off the area where the affected person was. We recommend that if possible, you open outside doors and windows to increase your air circulation in the area, and then wait 24 hours or more before you clean and disinfect that area. So if 24 hours is not feasible, you should just try to wait as long as possible. So after this waiting period, we recommend that you clean and disinfect all areas that were used by the person who is sick. And this includes offices, bathrooms, common areas, shared electronic equipment like tablets, touch screens, keyboards, remote controls, ATM machines. So this cleaning can be done using soap and water, and then followed by the use of a disinfectant. So CDC recommends using disinfectant products that are on EPA's list N, which includes disinfectants that are for use against the virus that causes COVID-19. It's important to make sure that the product you choose is appropriate for the surface and that the staff follow the product instructions for the concentration, the application method, the contact time, and of course the required personal protective equipment. And so once that area has been appropriately disinfected, it can be opened for use, and you can continue cleaning and disinfecting surfaces that are frequently touched by multiple people at least daily, and then maybe more often than that, depending on the usage level of those surfaces and objects.
Thank you, Dr. Murphy. So we're also getting some questions about what type of protocols employers need to think about. So Dr. Adams, could you answer the question, what what protocols should an agency follow if they decide to start taking employees' temperatures, if they start to do health screenings?
Well, conducting daily health checks of staff, and this would include temperature checks, can be done safely and respectfully, even in accordance with privacy laws and regulations in both business and mass transit settings. So we do encourage businesses to consider some of the following things. So first, developing and implementing procedures to check employees for symptoms daily upon arrival or as feasible. Also, of course, encouraging anyone who is sick with symptoms of COVID-19 or has tested positive for COVID-19 to stay home and follow CDC guidance on when to end home isolation. In addition, anyone who's had a close contact with someone with COVID-19 should also stay home and monitor for symptoms according to CDC guidance. And also, for planning for if an employee gets sick, either during health checks, spotted then, or throughout the day. And of course, regularly communicating and monitoring developments with the local authorities, employees, and the public. But specifically your question around temperature checks, if temperature checks are in place, there are several methods that employers can use to protect the employee that's conducting the temperature screening. So the most protective methods incorporate social distancing, so having the screener maintain a distance of 6 feet from others. So by asking them to take their own temperature or take it before they come into work. You could also rely on physical barriers, such as partition controls. So if a screener is using physical barriers, they can sort of reach around that partition or through the window and make sure their face stays behind the barrier at all times during the screening. If social distance or barrier controls cannot be implemented during screening, PPE can be used when the screener is within 6 feet of an employee during the screening. However, reliance on the PPE alone is a less effective control, and it's more difficult to implement given the PPE shortages and, of course, the training requirements. So after each screening, the screener will remove and discard the PPE, wash hands with soap and water for at least 20 seconds, and use hand sanitizer with at least 60% alcohol. So if performing a temperature check on multiple individuals, so if this is a routine thing that's happening, you really have to make sure that you use a clean pair of gloves for each employee and that the thermometer has been thoroughly cleaned in between each check. Of course, if disposable or non-contact thermometers are used and you didn't have physical contact, you don't need to change gloves before the next check. And if non-contact thermometers are used, you can just clean and disinfect them according to the manufacturer's instructions and facility policies. I hope that helps answer that question.
Great, yes, it did. That's very thorough, and I think if people want to refer back to that answer and all the steps that need to be taken, I know that information is on our website. Is that correct?
Yes.
Great. So I think another thing that people are worried about when they think about workplaces, that we're seeing businesses open in communities across the U.S. and customers are starting to interact with employees. How can businesses and employers keep employees who interact with customers safe?
Great
Dr.
question.
Adams, if you could take that, that would be great.
Yeah, great question, and something that's on everybody's minds, of course. And there are many things you can do to help keep your employees safe. So you should consider the options that you have to increase the physical space between employees and customers. Like, we've heard a lot about people opening a drive-through or click and collect online shopping, shop by phone, curbside pickup, erecting partitions, making floor guides to let customers know what the spacing of 6 feet apart is. You can also remind employees and customers that CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, so especially in areas of significant community transmission in public spaces. However, wearing a cloth face covering does not replace the need to practice social distancing. I just want to underscore that. Also, at least once a day, clean and disinfect surfaces that are frequently touched by multiple people, so including customers and other employees. So some of these things might be, door handles, desks, kiosks, phones, light switches, faucets. You also want to see if you can move the electronic payment or terminal or credit card reader further away if you have a cashier, to just increase that distance between the customer and the cashier. You also might want to consider assigning a person to rotate throughout the workplace to clean and disinfect surfaces. And consider scheduling hand washing breaks so employees can wash their hands with soap and water for at least 20 seconds. and also using hand sanitizer with at least 60% alcohol if soap and water is not available. You may also want to consider scheduling a relief person to give a person like a cashier or a service desk worker an opportunity to wash their hands as well. So those are some of the things that you can consider that are a little bit more general. And again, we do have some more specific guidance for particular business types on our website.
Great, thank you. And Dr. Adams just touched on face coverings, and I know there have been some questions in the question and answer box about face coverings as well. Dr. Kitt, I was hoping you might answer the question about if employees need to wear cloth face coverings or personal protective equipment, and that could be N95 respirators or gloves to protect themselves while working. I think there's a lot of people really want to understand what they need to do in a workplace setting.
Sure, thank you. That's a very important question. And as Dr. Adams mentioned, CDC does indeed recommend wearing cloth face coverings for source control in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community transmission. Cloth face coverings may prevent people who don't know that they have the virus from transmitting it to others. And these face coverings are not surgical masks or respirators, and they're not appropriate substitutes for surgical masks or respirators in workplaces where masks or respirators are recommended or even required. So employees should continue to follow their routine policies and procedures for personal protective equipment if there are any in place under normal circumstances for their normal job tasks that they would perform. When cleaning and disinfecting, employees should always wear gloves and gowns which are appropriate for the chemicals that are being used and should follow the instructions on chemical labels. Additional personal protective equipment or PPE may be needed based on the actual workplace and what the product being used is in place. CDC does not recommend the use of PPE in workplaces where it is not routinely recommended for other reasons. Facilities really should follow the hierarchy of controls, and we've mentioned a few of these as we've gone through the recommendations and the question and answer sessions. And these are such as administrative controls and the engineering controls like the partitions that we just talked about. And these strategies even are more effective at preventing exposures than wearing personal protective equipment. We do consider PPE as the last line of defense. So hopefully that helps answer that question.
Yes, it did. Thank you. And I want to make sure we have some time for questions related to mass transit as well, since we're covering both subjects today on this call. So Dr. Omura, I was hoping that you could talk a little bit about what actions transit agencies should take as they try to restore service.
Sure. Thanks, Malia. That's a good question. And as I mentioned during my presentation, we do have several documents that provide actions that transit agencies can consider as they make decisions about restoring service. So for example, last Friday, we released a decision tool document for mass transit administrators to use in making decisions about increasing service. And this is a helpful tool as transit agencies really try to think through restoring service. And then there are more specific considerations within the White House's Opening Up America document as well, which I reviewed in detail during my remarks, which outlines some interim guidance that can really assist mass transit administrators in maintaining healthy business operations. And again, I did want to remind people that we also do have guidance for other types of specific mass transit workers. This includes bus transit operators, rail transit operators, transit maintenance workers, and transit station workers. And those are all available on our CDC COVID-19 web pages. So I really do encourage people to go and review those.
Thank you. And the slide up that everyone's seeing right now on their screen really talks about those decision tools and the White House's Opening Up of America, again, guidelines. And so you can see some of the URL up there. And I know we've gotten questions in the question and answer box about whether these slides will be available. And as we said in the beginning, yes, a recording of this call along with slides will be available on CDC's website. And so I wanted to ask another question about PPE. So we talked about PPE in workplaces, workplace settings, but maybe Dr. Kitt, you could talk about what's the recommended PPE for transit operations staff.
Yeah, I'd be happy to. We first suggest that you follow the approach that I mentioned before of the hierarchy of controls. So this approach groups actions by their effectiveness in reducing or removing hazards or exposures. Implementing engineering controls will remove the potential to get exposed to COVID-19. And an example of that we've used before is building a physical barrier to separate you from passengers and customers, having a partition that actually separates passengers and customers. Another option is to use an administrative control. An example of this would be using visual cues such as floor markings to encourage social distancing, or to ask passengers to enter and exit through rear doors, or to enter through one door and exit through another. Personal protective equipment, as I've mentioned in the last question, is really the least effective control measure and should only be used when engineering or administrative controls can't be successfully implemented to prevent the exposure. So in this case, we suggest that mass transit employees wear a cloth face covering where feasible and promote healthy hygiene practices by hand washing. CDC recommends wearing that cloth face covering as a protective measure in addition to the social distancing. However, the cloth face coverings are not PPE, as I mentioned, and they're not a face mask or a respirator. A cloth face covering is not intended to protect the wearer, but it may prevent the spread of virus from the wearer to others. The Occupational Safety and Health Administration suggests that a worker wear a face shield if a cloth face covering is recommended, but for some reason the worker really can't tolerate wearing a cloth face covering. So in this circumstance, a face shield may be appropriate. In addition, we would suggest using gloves if required to touch surfaces frequently in the passenger area, or if you have to touch surfaces that may be contaminated, certainly by body fluids. So hopefully that helps answer for PPE for transit operations staff.
Yes, thank you. And I think folks were very interested in understanding that. And maybe relatedly, John, Dr. Omura, could you talk a little bit about environmental changes? So what changes should be made to operations or dispatch facilities, restrooms, locker rooms, ready rooms, where employees are interacting every day?
Sure, yeah, thanks, Malia, no problem. And there's a lot of similarity or overlap here between this and the worker guidance that Dr. Adams reviewed as well. But in general, administrators can consider for example, closing these types of communal use spaces, so things like break rooms, if at all possible. Or if that's not possible, they can consider alternative options like staggering their use and then ensuring appropriate cleaning and disinfection occurs in between use.
Thank you. So we talked about transit operations staff and PPE and face cloths, but what about passengers? So Dr. Omura, should transit passengers be asked or required to wear masks?
Right, yeah, and this really applies to all of us when we're going out in public. CDC recommends wearing a cloth face covering in public settings where other social distancing measures are difficult to maintain. So really when we're out in public and it's difficult to maintain that social distance. I think it's been mentioned a few times now that cloth face coverings should not be placed on young children under the age of 2 or on anyone who has trouble breathing or is otherwise unable to remove the mask without assistance. And as was mentioned earlier as well, if anyone has COVID-19, even if you don't have symptoms, cloth face coverings can help prevent you from spreading the virus to others. So a good way to think about it is that my cloth face covering protects you and your cloth face covering protects me. And it's also important to note that cloth face coverings don't replace other protective measures. CDC still recommends that you stay at least 6 feet away from other people, or maintaining social distancing, washing your hands frequently, and avoiding touching your eyes, nose, and mouth.
Thank you. And so related to the issue of staying 6 feet away from people, and some of the questions that have come in during this call, what spacing guidelines would you recommend for passengers aboard transit vehicles and in transit stations? We know rush hours can get crowded. Should bus and rail passengers be boarding buses and trains from the rear doors instead of the front doors? Many transit agencies have implemented this model as a way to keep the operators far away from and in less contact with customers. Dr. Omura, could you speak to that a little bit more?
Right, sure. This is a really great question, especially when administrators are thinking about how to encourage that social distancing, which is such an important principle of prevention. And I agree. I've noticed that it's something that we've been getting several questions about this. So transit administrators can encourage social distancing by instituting a number of measures. There's several strategies that they can implement to help physically separate or create that distance of at least 6 feet between both occupants and employees as much as possible. And so this can be things like, as you mentioned, asking bus passengers to enter and exit the bus through rear entry doors. Although it's important to allow exceptions for persons with disability. There are other options though, things like closing every other row of seats, reducing the maximum occupancy of buses, as well as individual subway and train cars. They can consider increasing service on crowded routes to help decrease those crowd volumes as appropriate. They can also provide physical guides to ensure that customers remain 6 feet apart, so that can be both on vehicles and at transit stations and stops. And so examples of this include things like floor decals or colored tape or signs, really to help guide and indicate where passengers should not sit or stand, those sort of visual cues. They can also consider installing physical barriers like sneeze guards or partitions. This can be at places like a staffed kiosk, for example, or on transit vehicles as much as possible, really. And then also, as I mentioned before, closing communal spaces as well. So things like break rooms or staggering their use as much as possible, and cleaning and disinfecting.
Thank you. So we've also received a couple of questions about ventilation and HVAC systems. Should HVAC be running at any point in the transit vehicle? And if so, kind of what settings should they be set at? Dr. Kitt?
So we would suggest that transit operators consider not recirculating air during ventilation of the vehicle, that it would be better to use, bring in fresh air, outside air, lower vehicle windows to increase air circulation, weather permitting, of course, but now that we're moving into the warmer parts of the year, it makes it a little bit easier. So bringing in as much fresh outside air as possible, I think is a really important point to make.
Great, thank you. And Dr. Murphy, I think, again, getting back to cleaning and disinfecting, but I think this time specific to mass transit, can you help us with a question that came in about assuming the use of a proper disinfectant, how frequently should transit vehicles or stations be cleaned and disinfected?
Yeah, thanks for that question. We do get a lot of questions about cleaning and disinfection frequency, and we understand how challenging it can be to plan for this. So we recently developed cleaning and disinfection guidance with EPA, and so there we state that surfaces that are frequently touched by multiple people. So in a transit setting, these are things like kiosks, digital interfaces such as touch screens and fingerprint scanners, or ticket machines, turnstiles, handrails, restroom surfaces, elevator buttons. These should be cleaned and disinfected at least daily. However, more frequent cleaning and disinfection may be required based on the level of use. So each facility and situation is unique. So we ask transit agencies to consider assessing these high-touch surfaces in their facilities and then developing a schedule for cleaning and disinfecting that's really tailored to their setting, and also feasible within their operation. So some strategies to consider might be cleaning and disinfecting the operator area between operator shifts, using touchless payment and no-touch trash cans like we talked about before, and doors as much as possible when they're available. Asking customers and employees to exchange cash or credit cards by placing them in a receipt tray or on a counter rather than by hand. Cleaning and disinfecting pins and counters and hard surfaces between each use or in between customers. You could also consider avoiding using or sharing items that aren't easily cleaned, sanitized, or disinfected, such as disposable transit maps. And then again, just want to make sure that employees are using gloves when they're removing garbage bags or handling and disposing trash, and then immediately washing their hands afterwards.
Thank you. And actually, one of the questions we got in the question and answer box, Dr. Murphy, I think you might be able to answer as well, and it was referring to using UV light for cleaning and disinfecting. Is that something you could talk about quickly?
Sure. So we get a lot of questions about UV light, and I know there are definitely some studies going on right now about the efficacy of that. So right now, CDC just recommends using surface disinfectants that are on that EPA list in that I mentioned. Those have been tested and approved for use against this virus. So as we learn more, and we're watching how these studies turn out, as we learn more about UV, and if it seems to be something that would be useful, of course, we'll update our recommendations on that.
Thank you. Thank you, Dr. Murphy. So I just want to bring our call today to a close. I know there have been multiple questions about these resources and where the audience can find them. So again, we would direct you to CDC's website. And as I said, this recording and the video with the slides will be posted on the website as well with a transcription. We've gone through a number of community mitigation strategies on the call today, and these are reflected in the guidance that sit on CDC's website. And so we encourage you to really explore the website, look at the guidance, and use that as you make decisions in your own workplaces as to what strategies you can put into effect to help keep your customers, your employees safer during this pandemic. I want to thank you all for being with us today and all you're doing to help protect people in your communities. We truly appreciate it. And I just want to remind people that this is one call in a series, and our last call of the series will be tomorrow at 4 p.m. Eastern Time, and that call will be focused on youth sports. So we hope to see you there. And with that, I'll just thank you all for your time today. And this call has ended. Thank you very much.